Welcome back to A Virtual View. Today I'm joined by Christina Hage, the Plan President and CEO of Managed Health Services, seen as MHS in the community. Christina, thank you so much for joining us today.
Thank you so much for having me on.
Yeah, so could we start off having you tell us a little about yourself?
Sure, I would love to. I have been with MHS for 8 years now. I started out leading external relations and did that. So that's basically anything that touches members, providers, community partners, our policymakers. I helped organize, create, shape those kinds of information and materials for the last 7 years. And then I was moved into the interim CEO role in November of last year and coming on a year of being in this role. Prior to joining MHS, I had a number of different positions. I spent about 8 years in Washington, D.C., and so I worked for the International Trade Office of the White House. I worked as a federal lobbyist, and I worked on Capitol Hill doing appropriations work. Probably one of the most interesting blending and braiding jobs that I've done from a federal and state funding standpoint. And then I moved back home to Indiana. So I grew up here. My family's all here. So I moved back to Indiana a number of years ago, and I worked at FSSA. I worked at Cummins, and I worked at United Way of Central Indiana prior to joining MHS.
Wow, so you have a lot of experience in a lot of different places.
Yeah, a lot of different backgrounds serving different stakeholders, but very focused in healthcare and how healthcare kind of shapes your life, honestly.
Yeah, it's such a big part of just being a person that I can imagine why you keep coming back to it.
Yeah.
So to start us off, can you explain a little about what health literacy means?
Sure. So health literacy is your ability to understand the information that comes to you on your medical care. And often it loops into how social determinants of health play into your life. So social determinants of health can be anything from your housing to something that's close to my heart, which is food, and food is medicine. But it's really understanding what a physician or medical professional tells you and being able to use that information to help you have a healthy life. So as we think about health literacy, when you go visit a doctor, you're often given a lot of information. And so the ability to understand and then make that actionable is health literacy.
And what's the impact on those who have lower health literacy, who just don't have the same level of understanding or ability to utilize that health information?
Yeah, that's a great question. So it can have a myriad of different impact. One of the things that we always suggest is that you take a notebook with you when you go to any provider visit. And I do that personally because it's often a lot of information. Plus, you could have your questions prepared or your concerns prepared ahead of time that reminds you on how to speak and how to ask your questions. But if you have lower health literacy, sometimes you have concerns about asking questions, or if the information that's provided is pretty complex. So if you think about going into your physician, you're given a lot of numbers when you first start, whether that's blood pressure or, weight or other things, pulse. Those are numbers thrown out to you. And if you don't understand what the numbers are over one another, it may not mean anything to you. And so understanding what the numbers are, understanding if you are on prescriptions, how those interact, or what are those side effects is incredibly important. So if you walk in and there's sort of a different level of understanding, often individuals can walk out and have been given a lot of great information, but nothing's actionable because it's not clear what they should be doing versus not doing. So it's incredibly important to have those building blocks and then to work with our providers to understand, where individuals may be coming in from a health literacy standpoint.
Right. I do like that you mentioned writing questions beforehand because it's really easy to think in the car on the way to the doctor that you're
Yeah.
like, okay, I'm going to ask about this. I'm going to ask about this. But then you get there and you're in this unfamiliar environment. And that can be a lot harder to remember those questions.
Yeah. And I keep one notebook. So I actually got it out
Mhm.
to remind myself as we were coming into the podcast. Like I keep one notebook of my different visits. And then that way I can look back and understand. Because even though I do this every day, healthcare is personal. And
Right.
so, if you are concerned about something, it is really easy to forget it when you're sitting in there. And I actually had a physician that I worked with a couple of years ago provide what he called like an overview of himself, and then what he called the door handle rule. And the
Hmm.
door handle rule was that don't wait until I put my hand on the door handle to ask me your questions. Like let's talk about it. And I think sharing kind of his personal background and things helps patients become more familiar and comfortable. It can be nerve-wracking. It can be uncomfortable, right? And so making
Right.
those barriers easier is really important. And health literacy can do that, and then work with providers can help do that.
Right. Yeah. Because it's not just the providers that need to think about health literacy or the patients, it's them together.
Correct. Exactly.
Right. So let's talk about the importance of health literacy in our more rural areas. I do work for the Indiana Rural Health
Yeah.
Association. So, but why is this something that's so important for us to address when we're thinking about health literacy?
Well, each part of the state is different, as you know.
Hmm.
And so in our rural communities, we have seen a decrease of providers and provider services.
Hmm.
So that if you need to drive 40 to 50 miles to see, a specialist or something like that, that can create a barrier. So then you're only really accessing services at that acute need where you just can't ignore it any longer. So
Right.
that's probably one of the biggest barriers, is just the access to where providers are located and the services. And then additionally, depending on, you know, if you drive through different communities, there's different wealths of information, right? And so if a community hasn't had access for a number of years, some of that information may just not be there for the community to access. Like I think the
Hmm.
Indiana Rural Health Association does a great job of providing, knowledge and information into different communities, but there's still sometimes that lack of information, and that I see more in our rural communities than some other more metropolitan parts of the state.
Oh, for sure, because I live in Indianapolis, and so I can drive,
Me too.
like, I don't know. Yeah, it's a great city, but
Yeah,
I can drive 20 minutes in any direction and find, like, I don't know, like a dozen provider offices on the
me too.
way. Like, if I need to go see a specialist, I have, like, 4 different large hospitals to choose from, but if I'm
Right.
living in, like, I don't know, like Vermilion County or
Right.
something, yeah, it's not gonna have the same sort of infrastructure there for me, and so I'm not gonna have the ability to connect with these providers. So, yeah, there's countless barriers, but I think a big one is access.
100%. And then when in the Indianapolis area, you often interact social settings and in other
Mhm.
places with providers naturally. If you are not doing that in sort of your everyday life, again, I think that that shapes your experience. And so figuring out unique ways to get access, I think, is part of the puzzle we're trying to solve right now with kind of the changing landscape of healthcare over the last handful of years, particularly the post COVID years.
Yeah, like, there was already that change in place, like, in motion as we move towards a more digital focused healthcare landscape, more value-based care, all of that, but then COVID just drove everything into, like, overdrive. So,
Correct. And the way
yeah.
people access healthcare has just, it's changed. What I'm always telling and talking to folks about is like, what is the change you're seeing? What are the what are the new barriers, the new trends? Because the way folks access healthcare is different post COVID than it was previously. And we can see that through trend data and some other tools, but it's also understanding and recognizing that part of society did shift and
Mhm.
building an infrastructure that helps support today's needs, not the needs that we had 10 years ago.
Right. Like you mentioned social drivers or social determinants, whatever you want to say,
Yeah.
of health at the beginning of our conversation today. And I think it's really interesting how integrated broadband and internet access has become as a social driver of health. And
Yeah.
it's one that can be very detrimental for our rural communities if they don't have it.
Well, and that's part of the reason we have a program called MHS Serves that helps
Hmm.
address some of the. It's a more like a micro grant program that supports
Hmm.
different communities around the state, and we partnered with 21 different organizations last year to address broadband issues. So it's different proposals. Like I said, each part of the state looks different and is addressing it differently. So some of
Right.
those investments were more around understanding digital literacy, and others
Hmm.
were closer to more access. But each
Hmm.
community needed something different. But to your point, the way often to access particularly specialists or different kinds of care is through a digital platform. And without that
Right.
access, it can create unnecessary barriers.
Right. And there has been, I read some articles the other day for Health Literacy Month where I was writing my monthly blog about a telehealth topic. And there was a concept of like telehealth literacy
Mhm.
about the integration and like the intersection of this health literacy skills and then digital literacy, and how a lot of times to interact with the modern healthcare system, there needs to be sort of an intersection of both of those. And
100%.
so yeah, yeah. So we transitioned pretty nicely into the telehealth of it all.
Yeah. Well, and
Yes.
telehealth was, I mean, if you can recall 5 years ago, it was nearly unheard of, right? Maybe a
Right.
couple different platforms, but COVID again really shifted that, and that becoming a normal way of accessing healthcare services. So we're seeing definitely a lot of demand. The benefits of telehealth is you can bring a specialist right into your home or right into sort of a safe environment that can
Mhm.
help support in a faster way. So it can get you access sooner, it can get you information sooner, and they're able to see kind of your labs or your scans or whatever from a diagnosis standpoint and really ensure that we're catching things earlier and not later, to help support that. Additionally, we've seen telehealth work really well in schools. So
Mhm.
MHS supports 5 different telehealth clinics in different school systems. We have a lot of different partnerships with schools, but we have 5 telehealth clinics that serve everything from, like ear infections, right, that would keep you out of school, to support
Mhm.
from a behavioral health. And that is done sort of in the safe environment of a school nurse. But then you can have the practitioner remote in and be able to support right there when the need arises or to prevent larger issues. And parents then, don't need to take off work to, take their child or student to an appointment. So it adds a lot of benefits from a telehealth standpoint, from an access, convenience, and ability to talk to specialists that may only be located in, like I said, more metropolitan areas.
I am a big proponent of telehealth usage, but accessibility and just access, particularly to specialists, is such a valuable part of utilizing this. It's like you said, maybe 10 years ago, telehealth was only going to be used in like really specific
Right.
circumstances. But now, like my parents, who are not the most technologically literate folks, do sit down and go to the doctor on the computer. So it has
Yeah.
become increasingly normalized. And they're in a rural area too. So I've seen this in my personal life.
Yeah. And you can do remote patient monitoring,
Right.
particularly if you're, working with a chronic illness and trying to, keep it regulated, remote
Yeah.
patient monitoring is amazing. And
Hmm.
we didn't really do that 10, 15 years ago. But it allows you to also stay in rural communities versus needing to move to where there's access. And that's part of the benefit is, ensuring that communities can thrive no matter where they're located around the state.
Right. If folks can receive treatment in their own
Right.
communities, like that's the goal. That's what we're trying to do.
Exactly. Exactly.
So let's talk about the role that telehealth providers play in improving a patient's health literacy. What does that look like?
So I do think it's a little bit different. I think some of the same principles are the same, where it's really important to use plain language. I think it's really important to ensure that a patient gets to ask questions and allowing that time within a telehealth visit. But some of the benefits, as you think about how a provider engages, often they will be looking for, physical signs depending on why you're engaging with them. I always think primary care, it's really important to do those in-person visits, but in the interim, you can do, more remote, particularly for things like ear infections and sore throats and things like that. It's actually better probably to do it telehealth, particularly if it's contagious, but it's also thinking through from a provider perspective, that reviewing the history prior to someone getting on the screen with you, particularly if it's a newer patient, and making sure that you understand what the labs are. And that, again, the language is simple, the action items are clear, and you use probably what's called like the talkback method, where you have the patient or member kind of repeat back what are the action items to make sure that it's understood. It is really easy to get on a screen and maybe not recall the conversation.
Right. And we have those digital tools that go along with it, like patient portals and things like that, where patients can see their own test results. So there are a lot of different tools that
Yeah.
like work together to increase that. You mentioned earlier that when a patient doesn't receive that regular care, that eventually they're going to have like a emergency that they're going to have to
Emergency.
deal with.
Yeah. We
Yeah.
say
Yeah.
acute in healthcare because, like, you
Yeah.
don't want to, but yeah, an emergency situation that was possibly preventable, right? Or more
Yeah.
likely preventable.
Mhm. Yeah, and I think in these rural communities, really investing in that, particularly like with remote patient monitoring, things
Yeah.
like that can be so useful. Like if you can monitor someone's hypertension,
Correct.
um, you can avoid a heart attack, something like that.
Correct. And then you can calibrate, like if you are doing remote patient monitoring and you notice an anomaly trend, I mean, that's the benefit of technology and data is
Mhm.
we have vast amounts of data. It's making it usable. So that's also
Mhm.
important for providers that are doing kind of remote care, remote monitoring, is understanding the data that's coming back and
Right.
being able to use it and understand where the intervention timelines are and how to do that in a remote setting. It may be a little bit different than what you would do if you're seeing the patient every couple of weeks or whatever the cadence is.
Exactly. Exactly. So, talk to me a little more about the programming that exists to promote health literacy.
Actually, a lot of work goes into ensuring that common medical terms are understood. So it's both on, we call them members, providers call them patients. On the member side, like easy, quick tools, short videos. We found like short, just bite-sized videos are really helpful for different issues. But making sure like the basic terms are understood and it's that regular education process, because most of the time in communications, you need to see something 5 to 7 times before you see it. And then you need to see it or hear it 7 to 12 times before you can even take action on it. So, what feels like a lot of emails, information in different channels can be actually how your brain catches it and learns. And what you find is a lot of people, they'll remember that they saw it, but then it'll give them an anchor point to go and do more research or something like that. And so we build out that thought process that members are super busy. It is really hard to get anybody's attention. I mean, everybody listening probably knows that, right?
Right.
And so having that regular cadence and making it super easy to understand and sometimes fun. I mean, we try to incorporate fun because that'll stick with
Mhm.
you more than just kind of a regular post or whatever. So we're doing a lot of education. We do that when we engage members both in person, because we do a lot of in-person engagement. We do that a lot through digital channels. And then we also work with our provider community on understanding kind of what the barriers may be, what are good tips and tools. A lot of our practitioners have been doing this a really long time and are phenomenal, but it's just
Mhm.
kind of a good reminder, because if you do something every day, you may just not always keep it top of mind that, this individual may need a different set of information to make sure it's actionable. So that's why we could kind of give a bunch of different tools in the toolbox, because again, healthcare is very personal. Everybody's different. And when you're on your own health journey, there's a lot going on that, yes, the healthcare industry slash organizations address. But if you think about kind of your whole life, there's other things going on that are taking your attention. So we try to understand that, you're human and we're going to be here to support that journey.
Yeah. So, what are some of those tips and tools that you're providing those, at the risk of using the same word twice, providing those providers with?
So, particularly around medication. So, there's a lot of different medications, and multiple medications, whether it's brand or generic, have different names, different percentage of, calibration for that person's body weight or whatever they need. So, a lot of information around prescriptions and understanding that, and then explaining kind of different chronic illnesses and giving easy information that you can kind of just print down. So we have a whole library website for providers that you can print it down, and it gives, an overview of the illness or the condition, and gives some kind of helpful tips for the individual that you can walk through. A lot of that can circle around some of the other things we talked about, which is diet and environment. And so also kind of asking, most of our providers ask those social drivers of health questions. So that's
Right.
also cataloged in their system so that they can partner with us and they can partner with the member for the best possible outcome. So it's a lot of information. And then we do webinars with providers. We do visits. We talk about quality scores. So we spend a lot of time talking about data and quality scores and where each sort of organization is meeting. And then we do incentives around specific measures that we're trying to address statewide.
When we talk about all of this, like, let's talk about the future a little bit. So, what are some promising strategies, some new innovations that you see on the horizon for improving health literacy, not just in relation to telehealth, but just in general?
AI can build very specific future state, I believe, will be able to kind of be able to address and have conversations about issues. Now, that obviously needs to be calibrated. There's been some issues with that. But I do think, particularly in rural areas, that could be a game changer, right? If
Mhm.
you're able to do different access, kind of provider or health plan oversight of the information being provided, but it allows you to engage when it works for you and your family. I think
Mhm.
that's one of the big barriers, is that if you think, besides the emergency room and urgent care, it can be very difficult to go see a provider in that 9 to 4 window. For the most part,
Right.
people are working, they have kiddos at home, they're caring for a loved one. Like those hours, it's really difficult. So I do think being able to engage when it's not an emergency, not acute, in hours that are outside of considered business traditional hours, is something that technology is going to be able to catapult us into a better framework for access. I mean, a lot of times when I do telehealth, it is a Saturday, right? I don't need to go, like, I know that it's an ear infection, right? I mean, we deal with ear infections. I'm a mom. I know what it is. We can do a telehealth visit versus going and sitting in urgent care for however long, right? And so I think that that will help. I also think more enhanced patient monitoring and being able, now it's got some privacy risks. So I want to state that it's got some privacy risks, but I do think it's a promising best practice to be able to integrate a lot of that data and be able to engage earlier than when it becomes more of an emergency or you have an episode that, shoots up the data. Normally you can kind of see that trend line depending on what you're monitoring.
Yeah, we talked about it a little bit earlier, but there is so much data available to providers now. And there's issues with data bloat sometimes because you have all of these statistics you're monitoring, all of these health signs from all of these patients. We're overworked, we're understaffed. If you
Correct.
can, yeah, if you can utilize an AI tool to identify trends, then that's what they're great at.
Correct. And that's
Yeah,
what I think we'll see. At least I would anticipate seeing. I mean, again, healthcare is very personal and
right.
everybody has a personal experience with it. That's the interesting thing about both healthcare and education. Everybody has sort of a worldview because they've individually accessed it and they've had personal experiences. And so I just think we're going to see more expansion in that realm because it's
Mhm.
needed from an access and a time standpoint. People want things sooner. They don't want to wait for appointments. I mean, I waited like 6 months for an appointment because I wanted a certain provider in the Indianapolis area, right? So I took whatever her first available was, and it's 2 o'clock in the afternoon, so then I need to take off of work. So those things can be significant barriers, and if we can use technology to help support, whether it's scheduling, whether it's being able to access remotely, I think we're going to see kind of a transformation in how people engage in their own healthcare.
Yeah, there's a lot of promise, I think, in utilizing AI to take away some of those more administrative,
Me
like
too.
those time suck tasks,
Yeah.
particularly for our providers. Yeah, that's a really good point.
Yeah.
So, last but not least, one thing I want to make sure we address. So, if you could give one piece of advice to providers or policymakers working to improve health literacy in rural health and just overall, what would that be?
So that's a great question. So I kind of
I know it's a
stated,
big one. I know it's a
yeah, I
big
kind of
one.
stated at the beginning, policy is near and dear to my heart. I mean, public policy changes can impact thousands to millions of individuals with a passage and signature by the governor. So, in my mind, to make real change for large populations, that is one of the most important tools. What I will say is that the downside of some policy changes is that it typically is one change for a large group of people that it may make sense, it may not for different populations. So one thing is that each community looks a little bit different. And so I actually think having that representation from around the state, our legislators do a great job of bringing that voice into the policy, but continuing to look at healthcare with the understanding that communities access and look different. We redid the telehealth laws during COVID. And I do think staying up with whether it's AI or technology or both, from a policy, both to support the growth and innovation, but also to make sure that those privacy concerns are addressed, are really, really important for that group of people, along with really everyone, because everyone is getting access. And so protecting that data, but being able to not have antiquated rules that really don't make sense, whether that requires, which we did clean up, whether that requires like a fax or hard signature. I don't know very many people that do hard signature anymore. And so, but thinking through those like small things that create barriers, that can easily be changed for today's environment. And then from a provider side, I would say integrating EMRs, right? Not having individualized systems that can't connect to other areas. Same with our side on the health insurance side. Being able to have integrated data that's usable is incredibly important, whether that's understanding trends, ensuring timely and proper payment. All of those things interact with one another. And so building data ecosystems that work together, not against one another, is, I think, one of the things that we can be doing over the next couple of years.
Yeah, let's give people a view into their own health, the ability to control their own health experience. I think that's really important.
100%. 100%. And that builds health literacy for the individual too. The more you're exposed and understand the numbers, the better consumer, the better patient you're going to be. So it's really has multiple benefits.
Yeah, I want to get people empowered to understand their own health.
Right, 100%.
Well, Christina, thank you so much for taking the time to chat with us this morning. I think I learned a lot about a really important topic.
Thank you so much for the opportunity. This was a wonderful conversation.
I'm so glad.
Thank you for listening to A Virtual View. You can find more information about today's episode in the show notes below. If you would like to support our podcast, please rate and review us on your favorite podcast platform. Do you have any questions or topics you'd like us to discuss? If so, contact us at info@umtrc.org or through the form found in the show notes. Also, we'd like to give a special thanks to our editor, Tristan Yoder. Finally, a special thanks to the Health Resources and Service Administration, also known as HRSA. Our podcast series, A Virtual View, is sponsored in part by HRSA's Telehealth Resource Center program, which is under HRSA's Office of the Administrator and the Office for the Advancement of Telehealth. The content and conclusions of this podcast are those of the UMTRC and should not be construed as the official policy of or the position of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Thanks for listening and have a great day.